Hi, everyone. Welcome to our Facebook Live session. We're excited that you were able to tune in with us today to learn more about our Master of Healthcare Innovation program. My name is Megan Alexander, and I'm the Assistant Director for Student Affairs, Equity, and Inclusion at The Ohio State University College of Nursing. Part of my responsibilities include helping to recruit for our academic program, so I'm very excited to be with you here today to share more about this exciting and unique graduate degree option. I'm pleased to be joined by Dr. Mike Ackerman, who is our Program Director for the MHI program, and today we're going to talk a little bit more about what the MHI program is, how it can help advance your career, and what makes a competitive applicant to our program. You're welcome to use the chat box and ask questions at any point in time if you have them, and we'll make sure our team helps you get those answered. So before we get started, I'm going to turn it over to Dr. Ackerman and ask him to introduce himself to our audience.
Well, thanks, Megan. I appreciate it. I'm Mike Ackerman. I'm the director of the Master in Healthcare Innovation program, and I have been at the Ohio State University for just over a year now. I've had a variety of roles in healthcare from, I actually started as a candy striper way back in the day, and have had a variety of leadership roles, clinical roles, and most recently, director of this program. I still practice as a nurse practitioner, so I see every day the challenges we have in healthcare, and have always been involved in innovation, whether it's product development, system change, written about it, studied about it. So very excited to be involved in this program, and very anxious to tell you more about it.
Thank you. We're so glad that we have Dr. Ackerman on our team and helping us leading this program, and that he was able to join us this afternoon to talk a little bit more about it. So this program, it's really built on the idea of innovation and creating change. So can you tell us a bit more about what innovation is, why it's important to healthcare, and how you've seen it impact your own career?
Sure. Well, when I talk about innovation, I first start off with what innovation isn't. Innovation isn't just something new or something different. Innovation brings value to the end user. So whether it's new access to healthcare, whether it's new access to a device, but the key thing is that innovation brings value to the person that's using the innovation. And it's different than entrepreneurship, although entrepreneurship can be innovation, but not all entrepreneurship is innovation. And so what we do here is we prepare innovation leaders, and I'll talk more about that in a little bit. But innovation is not necessarily new or different, but it brings value to the people that we serve. And it could be products, it could be systems, it could be a new way of doing business. But the key thing is that it brings value.
Has it impacted and helped advance your career at all?
Oh, absolutely. So very early on, I think maybe I was born to be an engineer, because I always had this desire to kind of create things. And so very early on, I got involved with industry and creating new products. I spent 20 years at the University of Rochester. And at the University of Rochester, we developed a Center for Clinical Trials and Medical Device Evaluation. And in that center, we partnered with industry to create new products, new applications of products, and actually did quite well with that, with some very notable contributions to science as well as the medical technology industry. So yeah, I've always been involved in it. The beauty of the MHI program is it combines innovation with leadership, and that's also been an area of in my career that I've spent a lot of time in. I've had a variety of leadership roles, studied leadership, studied culture. So yeah, it's really been the whole innovation leadership piece has been a big part of my career.
Yeah. So this is a relatively new program. I'm not sure if our audience realizes that it's not only is it new here at Ohio State, it's pretty relatively new in terms of a national level program. And we just actually recently graduated our first group of MHI students just this past summer.
Yes, we did.
So how are our MHI alumni putting into practice the things they learned in the classroom?
So the MHI program is designed to prepare boots on the ground innovation leaders. So unlike some other leadership programs that are more finance or business oriented, we're preparing innovation leaders. So what we see our graduates doing is moving innovation forward through or pushing innovation forward through a healthcare system, whether it's a product, whether it's a new way of doing something, whether it's a modification of the electronic medical record. And one graduate that I'll speak of is actually a director of perioperative services in one of our health systems. And she was tasked with creating a model to provide better access and better patient experience in some of our ambulatory surgical centers. And so it was a real world type of project that she did, and she was able to apply it to her job and actually brought great value to patients and also the healthcare system itself. So I see our graduates, our current graduates, as well as our future graduates being these boots on the ground people who move innovation forward within the healthcare system. Healthcare system being defined very broadly, not just the hospital. It could be patient care, but it could also be insurance. We have some students that work in the insurance industry. It could be physician credentialing. It could be access. So we define healthcare very broadly.
That's wonderful. And since we've graduated that new class, we also have 2 new cohorts of students that have joined us and are moving through the program. So we're really excited to see the great work that they're going to accomplish as they continue on with their studies and then eventually graduate and go out and change the world. Dr. Ackerman, I wonder if you can tell us a little bit about what the MHI program here at Ohio State is like.
Well, I would love to tell you that. So the MHI program, it's a master's program. And it's a leadership program that is grounded in innovation. So we teach the traditional leadership courses, like our first course is a leadership course, but all of our courses have an innovation spin, whether it's teaching some of the science around innovation, like complexity theory, change theory, complex adaptive systems, or it's how we teach the course. So we use one of the tools is mind mapping, which is a really innovative way to teach process and kind of mapping out different projects. So it's got a heavy leadership component, including communication, evidence-based practice, and we also teach policy and design thinking. So it's a well-rounded leadership program that has innovation as its core. And as I said, it's really designed to teach, to provide people with the skill set to move innovation forward. And the literature is very clear that the healthcare system today is not equipped from the CEOs all the way down to meet the demands that of our patients right now, especially with respect to innovation. So we think we're right on when it comes to preparing the future leaders for healthcare today. And I'll talk a little bit towards the end about our capstone, but the course content itself is very leadership focused with innovation at the core of pretty much everything we do.
And the time to degree, it does take 2 years of study in order to complete this degree. And in most cases, students are completing 2 classes per semester.
Yes.
And so it's a very doable course load for an individual who is working while they're also going to school. And we definitely anticipate most of our students are professionals and are advancing their career while also going back to school. So in addition to all that great information from Dr. Ackerman, we do want to highlight that because this is an online program, students will receive in-state tuition regardless of where they live. And we are authorized to offer the MHA program to students and residents of any state in the United States of America, with the exception of Colorado. So we are authorized basically countrywide in order to enroll and really invest in you as a student and help you advance your career. So we spent a little bit of time talking about what innovation is, what it is for the MHI program, as well as how it can help advance a student's career. So I think it's a good time now to talk about the type of applicants that we're looking for. So at a minimum, we do require that our applicants have a bachelor's degree from a regionally accredited university and a minimum GPA of at least a 3.0 on a 4.0 scale, either at the graduate or undergraduate level, depending on the previous education you have completed. Your bachelor's degree can be in any discipline. It does not have to be healthcare specific. But Dr. Ackerman, could you tell us a little bit more about what the faculty are looking for in a competitive applicant?
Yes. So first of all, you have to have an interest in innovation. And that doesn't mean that you have to have done innovation before, but you have to, the ideal applicant is somebody that, we talk about this all the time, you have to be comfortable with discomfort, because a lot of innovation is disruptive. And so we tell students, you got to lean into your discomfort, because a lot of what we do is on the fringe of what is normal in healthcare. And in order for us to move the system forward, we have to be disruptive. So we're looking for people that are comfortable with discomfort. We're looking for people that are intellectually stimulated to create new things. What I love about this program is it's a multidisciplinary program. So we're looking for people from a variety of disciplines. And it doesn't just mean that you have to work in a hospital. You don't have to be working in a healthcare system. As I said, it could be somebody from the insurance industry. It could be somebody from a product, a pharmaceutical company. And you have to have, your goal should be that you want to assume some leadership role in healthcare that involves innovation. Other than that, that's really all we're looking for. It's not necessarily difficult work, but it's a lot of work, and it's a different type of work to engage in this innovation journey. So, and you have to want to have fun doing it, because we do as faculty have a lot of fun doing it. And so you don't necessarily have to be in healthcare, but you have to be interested in innovation. You have to want a leadership role or aspire to a leadership role at some point. You don't have to be in one right now, but you should be aspiring to be in a leadership role. And you have to want to change how we do things. And you have to be comfortable with being uncomfortable. So, and that's really it.
So we are currently accepting applications for our summer 2019 admission window. The deadline to apply is February 1st, 2019, and you can access that application by visiting gpadmissions.osu.edu. We have a comprehensive list of all the required application materials on our website, which is mhi.osu.edu, and I would encourage you to take a look there and review all those requirements prior to starting the application. The materials we need include transcripts, we need a current resume, a statement, which has a little bit of a unique aspect to it as well, and 3 letters of recommendation, in addition to an online interview that you'll complete once your application is submitted. So please feel free to look at our website and email us. The address is mhi@osu.edu if you have any questions about those requirements. Again, as a reminder, you're welcome to submit any questions you have via the comment box, but I'll turn to our support staff and see if there's any questions that we have received or that we could answer.
Yeah, we've had a few questions. So you were talking about, this degree kind of being outside of the healthcare and really innovative. So what kind of jobs, after you obtain this degree, what kind of jobs are maybe if there is a typical route that people take?
So we get asked this question all the time: what kind of jobs? Any place that there's a need for leadership in healthcare is an opportunity for an MHI graduate. Healthcare right now is there's a certain amount of urgency in healthcare with respect to leadership development. And our current way of developing leaders hasn't necessarily met the needs of the healthcare system, because the healthcare system has evolved from more of an industrial model to more of a knowledge worker, innovative model right now. So it requires a different skill set. So what I see our graduates doing is filling these roles where innovation is required. They're in a leadership capacity, and they've been charged with moving innovation forward. So that could be any place. It's really very difficult to say, well, this is be the job for you. You're going to be a manager of this department. You're going to be a supervisor in this department. You're going to be a innovation director in this department. I think this is so new. Part of it is we don't know yet, but I see our graduates filling traditional roles that were filled by other leadership type programs that are going to require, just for survival, to do a lot of innovation work. So I think the opportunities are endless, and I think there's a lot more visibility now on innovation in healthcare. So I just think the whole market's going to explode.
Are there any other questions?
Yeah, so can you tell us what type of support students in the program will have from faculty?
Oh, sure. Before I do that, let me just talk about, I talked about the curriculum, but I also want to talk about at the end of the program that you do a capstone. And I think it's important to talk about the capstone because we get a lot of questions about what is the capstone. So currently the capstone is a series of courses that you come up with an idea, and it could either be individual or group work. We actually are encouraging group work. And as this program has evolved, we have started to form partnerships with certain people in industry, in the healthcare setting, where they are coming to us pitching ideas about where our students could fit. So for instance, a company may come to us and say, you know, we've got this new idea, we're a startup company and could really use a group of students to help move this innovation forward. So the student enters the capstone with an idea, and then over the course of the capstone experience, those courses, they continue to develop the capstone with the idea that they actually will implement this capstone and then evaluate and decide, you know, do we adopt this, do we abandon it, or do we modify it? That's all done with the faculty, who I'll talk about in a minute, as well as a community partner. And it's really important that our students go out and kind of immerse themselves in wherever setting that they're in and come up with a partner that will help support them, because we as faculty can support them in this capstone experience, but it's really important that somebody that they're working with in this setting supports them, because that's going to be the success. We want them to do projects that are meaningful to their own organization, that support their strategic plan, and sometimes that's possible, sometimes it's not. So that's our capstone experience, and that really is going to be what we hang our hat on, is the success of those capstones. And we're very excited about the process. Our faculty are, of course I'm biased, but they're world class. We've got one of our faculty works for Kaiser Permanente out in Northern California, and really nobody does innovation better than Kaiser. And he works as a senior innovation person out at Kaiser. Another one of our faculty has written, I think she's up to 10 or 11 books on different aspects of leadership and innovation. So she's another one of our faculty. It's Kathy Malik. The person that works at Kaiser is Dan Weberg. Dana Wade is another one of our faculty who came up through the Cleveland Clinic, and she's done a lot of innovation work there. There's myself, as well as Tim Rattersdorf, who's our Chief Information Officer here at the College of Nursing at The Ohio State University. So we're very proud of our faculty, and when you look at a program, you look at curriculum, you look at students, and you look at faculty, and I would put our faculty up against anybody that's out there right now. So it's exciting. You got to get used to people that live in the innovation space, because sometimes we're not as organized about things, and we kind of let the students create as opposed to give them a cookie cutter approach to doing things, because that's life. And we tell them when they get out, we tell the students when you get out, there's not going to be a cookie cutter for you. Okay. So sometimes the instructions maybe give students a little more freedom to do things than what they're used to, but that's by design. And we all kind of think that way. But that's our faculty, and that's the experience you will get when you come to our program.
That's great information. Do we have more questions?
We do. One question, the first one is, does the program require you to be present for class in real time? So what is the delivery format?
Oh, good question. So the program is 100% online. And we use a combination of synchronous and asynchronous learning. So, and what does that mean? That means, so synchronous, and you'll know this when you register for class, when your synchronous classes are. So synchronous classes are a designated day and time that the whole class, or a portion of the class, depending on how it's set up, is online, present with the faculty. So that's synchronous. Pretty much all our courses have a synchronous component. There's a couple that don't, but pretty much all of our courses have a synchronous component. So when you register, in the registration, it'll say, okay, like for instance, I like to have my classes every other Monday from 5:15 to 6:45. So going into the class, you got to block that time out. So, and we get together and we have a live synchronous class. I usually record them, so if the students want to go back and look at them, they can. And then there's asynchronous learning. And asynchronous learning is the week's activities have been set up in the learning management system, and you go at your pace. And most of our assignments are due by the end of the week, usually Sunday night at 11:59. But you work through the content for the week, whether it's readings, videos, assignments, and it's up to you how you get through your week. Online education requires a lot more discipline from a student's perspective than an in-class type of format. With an in-class format, you've got your 1 day a week, 2 day a week, 3 day a week time. You go, you sit in a seat, and you get you're in class. With online learning, a lot of it is you have to be disciplined enough to get the work done, because there is no, there may be a synchronous class, but often there's not a synchronous class, so you have to get through it. So, but we use a combination of synchronous and asynchronous, and that seems to work very well.
Are there any on-campus requirements for students?
We do hold, when you first enter the program, we do hold an orientation. We encourage people to be here if they can, but quite honestly, if you live in San Diego, we're not going to ask you to fly across the country. So we do use a web-based program that allows us to telecast pretty much everything we do. So it's not required. We encourage it if you can. But other than that, there's no on-campus requirement.
Great. Are there any other questions?
Yeah, we have a few more. So this person was wondering if you have any professional relationships associated with the program. For example, Arizona State has a professional relationship with the Mayo Clinic. Do you have anything similar to that?
Well, we're the Ohio State University, so we have Wexner Medical Center, the James. We have that affiliation, but we also have, and frankly, this last year I've spent a lot of time developing relationships with other types of organizations. So, we're in Columbus, so I've met with Ohio Health. We've met with other organizations. I've met with the Cleveland Clinic. So if a student came to us and said, I'd really like to do a capstone at the Mayo Clinic, we would reach out to the Mayo Clinic and help them do that. But, we're not aligned. The only reason we're aligned with Ohio State is because we are Ohio State. So, but to say that we have a specific agreement with a particular organization, I'd say, no, we don't. But if a student wanted a particular arrangement, we would make sure that we at least try to make that happen.
Great. Any other questions?
We do have one more question. Say that someone works 12-hour shifts. Do you offer maybe classes, some synchronous classes at later times or earlier times to accommodate them, or how does that?
Yeah, that's a great question. I'm sorry, I just kicked the camera. It was not an earthquake. That was me. So we also have faculty that work on the West Coast. So they prefer to have their classes later in the evening. So we have, typically our class times are either 5:15 or 7 p.m. You will know well in advance when these classes are. So, and having done schedules for people, I know that, schedules are sometimes done 3 months in advance, but typically you will know when these classes are well in advance, that hopefully you can schedule yourself off of those days. But yes, we do hold some classes later in the day. It's not 9 o'clock at night, but I think two of our faculty like their class at 7 p.m. The other thing is, I'll speak for all of our faculty, if you email and say, I really need to talk to you, and the only time I can meet with you is 8 o'clock at night, we make that happen. Or Sunday afternoon, is not, as long as it's not during the Bills game. Or actually, the way they've been playing lately, maybe it should be during the Bills game. But anyways, we will make it work. So, in answer to your question, some of the faculty do hold later classes, and we schedule well out. Like, I think our schedule has already gone in for spring. So, you'll know well in advance when the classes are. And none of the courses have a synchronous requirement every week. So, it's typically every other week or every third week. It just depends on what the faculty wants to do.
Great information. Is there anything else?
That is all we have.
Great. Dr. Ackerman, do you have any closing thoughts?
No. Well, yeah, I do. But we've only got a few minutes left. I think that right now is a perfect time for innovation. And so just in the last week, and this pertains to nursing, but Johnson & Johnson just came out with a brand new program to fund nursing innovation. The American Nurses Association now has a fund to fund nursing innovation. And I know that's nursing, and we're a multidisciplinary program. But there are other organizations that are out there that understand that the people at the point of service are the ones that can drive a lot of this innovation. So now there's never been a better time for innovation. And we are one of, a handful of programs in the country that teach this. Our program was developed by people that are on the cutting edge of innovation and leadership. So I just think, I'm thrilled to be here. I'm having a blast doing it. And I think our students pick up on that. And it's just a great time for innovation. And it's a great time for us at the Ohio State University.
Great, and we're thrilled to have you here with us. So thank you so much, everyone, for taking time to learn a little bit more about our Master of Healthcare Innovation program. If you have any questions, please feel free to type them into the comment box, and our team will get back with you, or you can send an email to mhi@osu.edu, and our staff would be happy to assist you. So thank you so much and have a great evening.